Welcome, everyone. Plant-Powered Metro New York is happy to bring you 3 informative sessions with leading wellness experts. As a New York-based nonprofit, Plant-Powered Metro works to empower diverse neighborhoods and communities through nutrition education, celebrating our differences as well as our commonalities. Special welcome tonight to our participants of the Jumpstart program for NYC Health Plus Hospital staff. I'm Karina, Plant Powered Metro's virtual engagement manager. I'd like to thank our partners tonight, Riverdale Senior Services, for helping us bring this important series to you. So here's our plan for the evening. We'll have a 30-minute presentation, a 10 to 15-minute Q&A. At any point, please put your questions in the comments section or the chat, depending on how you're joining us. I'm so excited to introduce Dr. Williams. For so many of us, the results of our annual blood work can be so much to digest. We may not know exactly what our numbers mean or which steps to take next. If you've ever felt this way, we're glad that you are here tonight. Our guest will help us better understand our cardiac numbers and how nutrition addresses the root causes of hypertension and elevated cholesterol. And here is Dr. Kim Williams. Dr. Williams is the endowed professor of health equity and chairman of the Department of Medicine at University of Louisville. He originates from the South Side of Chicago and transitioned from the inner city Chicago public schools to the College of the University of Chicago, where he majored in biology. He trained at UC's Pritzker School of Medicine, internal medicine at Emory University, and then back to UC for cardiology, clinical pharmacology, and nuclear medicine. He's board certified in internal medicine, cardiovascular diseases, nuclear medicine, nuclear cardiology, and cardiovascular computed tomography. He's also served as president of the American College of Cardiology and the American Society of Nuclear Cardiology, and as chairman of the board of the Association of Black Cardiologists. His career has focused on advocacy for national nutrition education, eradication of national and international healthcare disparities, improved healthcare access, overall health systems reform, sustainable healthcare financing, and increased access to advanced cardiac imaging for all. Dr. Williams has been perennially named in America's top doctors and has received multiple national and international awards. We are so lucky to have him with us tonight. Welcome, Dr. Williams.
Thank you so much. I really appreciate the invite and the opportunity to speak with you again.
Thank you.
All right. Well, so I think it's my turn, and hopefully you can share my screen and move it over. Can you confirm for me, Karina, that you can actually see them?
I can see you, and in a second, I cannot actually see the slides yet. Okay. Jim will help us with that.
Yep, he was going to pull them over.
I wonder if you may need to present again. Click present again and pull them up one more time.
Happy to do
present. It. Yep. Do that again.
Okay. Share.
We have some good questions coming in already.
But I haven't even said anything. I understand that. Okay.
I can see the slides now. Thank you.
All right. So, well, this is part of what I normally do. I just want to say for the record that blood pressure and cholesterol are two of our top issues, but there are others, particularly diabetes, which is two diseases folded into one, and the inflammasome. And I'm hoping that everyone checks for inflammation with their C-reactive protein and checks your blood sugar or hemoglobin A1C, and does everything they can with diet and exercise to approach an ideal body weight. With that said, I'm going to focus tonight on blood pressure and cholesterol. So I just got back from the American Heart Association meeting yesterday, and there was a lot of interesting data presented, all of it looking terrible. We have not, with all our devices and new medications, and you might have heard some of it on the news about the late-breaking clinical trials and which drugs were working for heart failure and which ones were making things better. But it was all pretty much after the fact. the concern is that we have a global disease of cardiovascular diseases, and hypertensive disease is right up there. It causes a lot of stroke. It causes a lot of so-called ischemic heart disease. For those of you who aren't in the medical field, this is what you would call a heart attack, or when the arteries are narrowed, dropping the blood flow, so-called ischemia. And so we're feeling pretty good about that 24% decrease in the amount of ischemic heart disease. But starting in around 2015, things were actually increasing again, and they are predicted to increase again to well beyond what we had in 1990. If you look at all-cause deaths and attribution to risk factors, and particularly cardiovascular disease deaths, you actually see some really striking patterns. The high blood pressure that we're going to speak about today is really important. High LDL cholesterol is another major issue. But we have other risk issues, and they all roll up to sort of behavioral risk. Just focusing on this. If everyone were to do a whole food plant-based diet and not smoke, and then back off from the alcohol, do physical activity on a regular basis, and once everyone stopped smoking, the secondhand smoke issues would go away as well. We would have a dramatically lower mortality rate. Similarly, if we were to get control of the blood pressure, everyone should really, within the sound of my voice, should have a blood pressure cuff at home, measure them. In our 2017 guidelines, we try to convince people to measure their blood pressure and bring it to your doctor. Don't have the doctor tell you that your blood pressure is high. Reverse that. Bring the blood pressures to the doctor. And the issue with diabetes and high body mass index is massively increasing. And kidney dysfunction and LDL cholesterol now contribute to the death rate. Now, if we were to add all these things up, other than the smoking and the alcohol use, pretty much everything correlates with a plant-based diet. That is, people who become, excuse me, obese because of their diet have low physical activity. And so we could dramatically improve everyone's health if we got everyone to follow our guidelines. So these are 5 years old now, and I was happy to be on this committee and we'll work on the guidelines to try to get people to eat healthily. Some of this has changed, as you'll probably notice. Up in the left-hand corner, there's a piece of a salmon which we would no longer consider healthy. And but instead of doing those guidelines, we are developing more and more therapies, and the Ozempics and all the Jardiance and those wonderful commercials with the happy jingles. Well, they're all basically mops, albeit better mops, but we're still mopping up the floor instead of turning off the faucet. So how do we turn off the faucet? We follow those guidelines that I'm going to share with you. It's basically to eat more plants. 2 to 3 cups of vegetables per day is what even our very watered down federal guidelines suggest, and most of us don't do that. We have a horrific problem with obesity in this country that's growing rapidly, and a lot of that has to do with fast food, which is increasing our healthcare disparities because there's so much more of it in the poorer areas because that's where the business is. And so we end up with all of these risk factors, all of which we could impact with nutrition. So in terms of the blood pressure, the focus for tonight, blood pressure and cholesterol, I just want to show you the data of what happens if you do dietary intervention. If you put people, take them from an omnivore diet, eating everything, to a whole food plant-based diet, you see some dramatic drops. What is the cause of that? Well, we could talk about the microbiome. We will. That is the bacteria in the GI tract that improve when you stop putting decaying. Hard to say this in public without it sounding really gross, but it is gross. When you're putting decaying flesh in the GI system, that those bacteria populate the GI tract and change the characteristics of how the gut handles nutrients, drugs, toxins, and calories. And so what you end up with is more obesity and more inflammation, more blood vessels that are constricted. And we haven't even begun to talk about that's getting rid of the negative. The positive is that whole food plant-based diet not only changes your microbiome, but it has direct chemical effects. That is, if you're eating vegetables with a lot of nitrates and nitrites, and we're talking about beets and beetroot juice and arugula and kale, spinach, you're going to develop a lot of nitric oxide, that magic chemical that lowers blood pressure through opening up blood vessels. So no wonder that every intervention that, like the DASH trial here, very famous from Johns Hopkins, that red line is what happens to your blood pressure if you lower your sodium, which was the major thing that they were doing, okay? And you learn to use a lot of seasoning that's not sodium salt. And it turns out that if you do that, but also you adopt a diet that's lower in fat and cholesterol because it's predominantly whole food plant-based, you end up with more fruits and vegetables. That's where you get the more dramatic drop in blood pressure. If we focus on cholesterol, I just want to mention that it is one of the sources of our ethnic disparities. We know that hypertension is a serious issue, particularly in the African-American community. And we know that cholesterol was considered not to be much of an issue. If you look at this slide, it's going to tell you that the cholesterol in African Americans is just as good or better than everyone else, particularly on the male side. There's only one problem. All of this data that we were looking at, total cholesterol, never included the Lp(a). And I'm hoping that everyone not only gets your inflammasome measured, which we won't focus on much tonight, other than to say a high sensitivity C-reactive protein, if you are at risk at all, you should have it measured. Same thing for your Lp(a). Now, if someone already has coronary disease, really need to measure risk factors until you know that changing those risk factors will actually make a difference. And we don't have that data for Lp(a) yet, but we do know a lot about it. We do know that, number one, it is associated with more heart attacks and more need for bypass surgery and stents, and this higher stroke rate, higher cardiac death rate. The interesting part is that it is not equally distributed among us. But what is it? What are we really concerned about? Lp(a) actually makes your LDL particles much more likely to turn into plaque and then give cardiac events. It is homologous, or that is, it's similar to the clotting mechanisms in our body. And so you've got something that's in the cholesterol profile that actually can help make people clot. So who has it? Well, as you could guess, as our African-American population has 30% higher cardiovascular event rates, that it's actually the African-American population that has this ethnic disparity of higher levels of Lp(a). And so what are we going to do about it? Well, we have to do everything we can to get the LDL cholesterol down. And how do we do that so that Lp(a) can't cause us trouble? Well, a whole food plant-based diet intervention actually makes all the difference in the world. And you'll hear plenty of people say, not so many people say that diet doesn't affect blood pressure, but they will say that diet doesn't affect cholesterol, and that's completely wrong. It goes against all the data. This is an old slide from the Neil Barnard's group, where they just added up every study, and with very few exceptions, that when you change to a plant-based diet, even some not so great plant-based diets, some pesco-vegetarian, lacto-ovo-vegetarian, anything that gets rid of red meat particularly, but animal protein elimination would actually be the best, will give you this drop in the blood pressure. Now, much more recently, there was another analysis that was very similar, except it wasn't the studies from the 90s. It was much more recent data. And it was very clear that out of the 23 studies that had had looked at that were systematic reviews and getting rid of duplicate studies and looking at it very carefully, no question, despite what you might hear, no question that changing to a plant-based diet, vegan or vegetarian diet, would drop the cholesterol, the total cholesterol, the LP, the low-density lipoprotein cholesterol, and ApoB. Now, I promised you just a little bit about inflammation because it goes along with LDL cholesterol. Paul Ritker at Harvard has been talking about this for ages, and this is the one to remember. That if you have your LDL controlled, so-called, that is less than 70, which was our old target, okay, but you still have inflammation, a high sensitivity C-reactive protein of greater than 2, that results in a substantial elevation in the risk of cardiovascular death in people who are at risk. So that residual inflammatory risk just makes that LDL cholesterol even worse. So trying to control your LDL is one thing, controlling it along with getting rid of inflammation really makes the most sense. Well, how do we do that? How do we knock out both things? Well, the two things that I use every day in my clinic. One is a statin, atorvastatin, rosuvastatin in large doses. Not that there aren't other statins, but those are the most effective too. And a whole food plant-based diet. This one, the portfolio diet from David Jenkins, University of Toronto, 2003, and the Journal of American Medical Association made it very clear that if you do that as an intervention within 2 weeks, just about the time that your microbiome is changed over completely, you will have a fall in your LDL cholesterol of about 30% and a fall in your C-reactive protein of about 30%. Took the statin a little longer to lower the C-reactive protein because it hadn't changed the microbiome at all, but it ultimately did. Well, that study was repeated in a very nice way by Benita Shaw at NYU, asking people who were coming out of the cath lab after a coronary angiogram and a stent was placed, typically for a heart attack. They got 100 people to volunteer to be randomized to the American Heart Association diet at the time, which wasn't plant-based. It was less on red meat, more on more of a Mediterranean type of diet, poultry, fish. But they compared that to a whole food plant-based diet. And just like David Jenkins at University of Toronto, the NYU data showed a 30% decrease in C-reactive protein in the whole food plant-based diet group, and it showed hardly any change in the American Heart Association recommended diet. That really meant that we needed to change the American Heart Association diet, as you saw in the first few slides that we actually did. So we have a lot of information about lipids or cholesterol that people should know, particularly postmenopausal women. If you can lower your inflammation and all your inflammatory markers and your LDL, you're going to be at a much lower overall risk. And the things that are really good, that was published last year, is a lot of vegetables, a lot of fruit, and tea and coffee. I'm assuming that that's without the dairy. All right. We've actually gotten some really good data on people who are high risk and high cardiometabolic risk, meaning that not only are their LDL cholesterol elevated, but the body weight and hemoglobin A1C, meaning that their blood sugar has been out of control for the previous few weeks. And the best way to improve those parameters is a whole food plant-based diet. We've actually got data about animal-based diets and the fact that there's a lot that goes on when you're eating animal products, including increasing LDL. We've talked about LDL. We know that it makes plaque, but oxidized LDL is more dangerous. How do you oxidize it? Well, you have a high inflammatory system or smoking cigarettes. And oxidized LDL actually is 9 times more potent at making plaque than non-oxidized LDL. And so it's very clear that we need to lower our oxidative stress and inflammation, and the way to do that to improve your cholesterol, even before the numbers improve. To improve it, you do a whole food plant-based diet. I want to give you a little bit of the background of why this is happening. I mentioned it a little bit, that when you're eating decaying flesh, you're putting bacteria in your GI tract, and that the bacteria and the viruses and the like are actually more of your body's cell count than human cells. It's also protozoas and viruses, and wherever there is a microbiome, it does something. It could be helpful or harmful. And, if everyone says you should get your single shots because those viruses from long ago are within 99% of us. Well, that is true. But the discussion tonight really is about the bacteria inside the GI tract. It controls a lot of stuff. Your digestion works, whether you're eliminating or absorbing toxins, eliminating or absorbing calories, and how you deal with drugs and the like. And so all of our classic risk factors, including the two that we're focusing on tonight, high blood pressure and high cholesterol, are influenced by the microbiome. So there's plenty of research all saying if you get the right bacteria in your GI tract and eliminate the wrong bacteria, the ones that you're seeing in red, your blood pressure will go down. It's not just genes, it's not just hormones, it's your diet changing your microbiome. So for cholesterol, most of us weren't aware that the bacteria in your GI tract, that is a dysbiotic, a bad microbiome, actually promotes your cholesterol to go in, because it into your arteries, get absorbed, and where it ends up in the arteries, because it doesn't have the capability of getting rid of it like a good microbiome would. It has this bacteria with this ISMA gene, which actually will convert your cholesterol to caprostanol, which is excreted and not absorbed and ending up in plaque. And so we really have great information that we can lower cholesterol dramatically if we have the right genetics in our microbiome coming from the right bacteria. And it looks like this. Sure, you can cut your cholesterol by putting on a statin or stopping eating it, for goodness sakes, but you're still going to make some cholesterol. No matter how much of a statin you take, it's going to go into your GI tract along with anything that hopefully you're not eating. If all you have is the liver making cholesterol, you still have to absorb it. And are you going to chew it up and excrete it, or are you going to absorb it and have it end up in plaque? And that depends on the bacteria in your microbiome. So in closing, I want to get back to the guidelines, because we really do have good data that if a person does a diet that's predominantly vegetables, fruits, legumes, nuts, whole grains. I'm not going to talk about the fish just because it's a whole nother topic that needs a good section. I'll just give you a hint. Microplastics. So no one should be eating anything that comes out of the sea until we learned to stop polluting it and somehow get the plastics out of the oceans and out of the water supply. But that's on the plus side. On the negative side, getting rid of saturated fat and cholesterol and sodium. Best way to do that is a whole food plant-based diet. Getting rid of processed meats and refined carbohydrates and sweetened beverages. Again, whole food plant-based diet. And what happens if you do that? We get some very nice intervention studies. This one is very famous. You probably saw it before because it was on Netflix. And the fact of the matter is they showed dramatic improvement of all of the risk factors, particularly LDL cholesterol and inflammation. But they also showed something that's off topic, but really important. And that is a vegan diet stopped the aging process. So please remember that and tell everybody you know who's eating animal products that they're just aging unnecessarily. We always want to remember that we have these healthcare disparities that I have strong feelings about after reading all of the medical literature, that we could actually eliminate them. All we had to do is change to a whole food plant-based diet, as was shown by the Adventist Health, where the hypertension, the high cholesterol were cut essentially in half. Did not happen for the pesco vegetarians because fish are not good for you, and now they're toxic. But we also did that same kind of risk factor assessment on the south side of Chicago at President Obama's old church, where we got a bunch of people agreeing to change their diet for Lent one year. And using a diet that was consistent with our 2019 ACC/AHA guidelines that I mentioned. And every marker that you see in the middle of this page, the TMAO, the LP(a), inflammation, LDL, all of the stuff, including blood pressure, went down dramatically. A 10-point drop in blood pressure. And we were at the American Heart Association. There was a big analysis of church group interventions, and they got 3 millimeters off the blood pressure. Why? Because it wasn't a whole food plant-based diet. We got 10 millimeters off the blood pressure. And that 10 millimeters was after as a net result, even though people were coming off their blood pressure medications. So the actual effect would have been much larger. So anyway, that is the classic graph from a whole food plant-based 5-week intervention, all of the risk factors going down substantially, particularly that toxic chemical TMAO and insulin levels, but also blood pressure and all of the cholesterol parameters, as well as this high sensitivity C-reactive protein. And so we were able to take a population who's high at risk and cut that risk over in half in just 5 weeks. Now, obviously, the 10-year ASCVD risk, which I hope everybody has, because you got a holiday coming up and you're going to see Uncle Joe and you're going to talk to him about their cholesterol and the blood pressure. Our topic tonight is what goes into that calculator. If you don't have that on your phone, just download it, ASCVD risk. You'll see the app come up, and just go through everybody in your family who you think's at risk and tell them if they have more than 7.5% 10-year risk of heart attack, stroke, or death, they need to see somebody soon. And one thing that you can recommend to them is whole food plant-based tools, and there's loads of them. If people go on the internet, just Google those words, whole food plant-based, you'll find this one. This is a cookbook from the Association of Black Cardiologists that I co-authored, so-called Heart and Soul. In closing, I just want to try to get your help. I know a lot of our some of the people in our audience are physicians and some are not. I would like to get help from the physician side and more from the patient side to bring your doctor a gift, not a apple for the teacher. That's not a bad idea, but bring them literature on whole food plant-based diet to decrease heart attack, stroke, and death, decrease the high blood pressure and the LDL cholesterol that we're talking about. And it's not that we don't find the medications helpful. I find them extremely helpful. But who needs medications if you can do it based on our guidelines, which is lifestyle first? So anyway, this is the saddest publication of my long publication career, where we did a survey of 2 academic medical centers that we were working with. We have met the enemy of nutrition, and he is us. It turns out that 11 were following the ACC guidelines and following the medical literature, which would mean exclusively plant-based. That was 1 person out of 274. We need to change. We need to change every medical meeting. This was the images from the food. I just couldn't help but take a picture from the American Society of Preventive Cardiology. So we're really good at mopping up the floor. We're not thinking about turning off the faucet at all. We need to make a change. So what I would hope everyone would do is send this to your doctor. These are the 6 principles or 6 pillars from the American College of Lifestyle Medicine that we should be much more physically active, managing stress, staying in good, loving relationships, making sure that you're sleeping 7 hours a night. The alcohol, the cannabis, the cigarettes, obviously the people think they're doing cocaine and they're getting fentanyl instead or in addition. All of that needs to stop if we want to have a healthy population. And the most important cornerstone in the upper left is a whole food plant-based diet. So I'm going to ask you to do one other favor instead of just talking to your doctor. I'd actually like you to stare at this just for a moment. And that is what I'm hoping that you would do is maybe take a picture of the screen or something like that and recognize that these are 61 different issues, way beyond just the blood pressure and cholesterol that we're talking about tonight and the cardiovascular disease that we're dealing with all the time. But each one of these is related to the consumption of animal products and can be reduced or improved or even eliminated if everyone were to adopt a whole food plant-based diet. So your assignment is, if you would please take a picture of the screen, if there's anything that you know of that has medical literature behind it, like all of these do, and it's not on the list, just let me know. All right. Thank you very much. I'm going to stop sharing and open it up for questions.
Thank you so much, Dr. Williams. That was really great. We do have a bunch of questions. Our first one is from Andrew, and he says, I have or had a blood pressure reading of 195/85. But the funny thing is, no doctor was able to tell me the reason why. I suspect it was the food I was eating. And basically, you did speak to that. But do you have anything else you'd like to add for Andrew?
Oh, you bet I do. And I still struggle to present this data, but it's been out here for about 5 years. And one of the things that we know would rate, if you went into the hospital with low blood pressure, they would put you on pressors, epinephrine, norepinephrine. Okay, during a heart attack, blood pressure is gone. You inject epinephrine, intracardiac if you have to. Well, suppose you were eating something that had a lot of epinephrine in it. What would happen to your blood pressure? It could skyrocket. And so the uncomfortable conversation is, I would encourage everyone to Google the terms, or how about just one catchphrase, which was one clever article. Meat with a side of cortisol. It's not just epinephrine and norepinephrine, or adrenaline, as it's called. It's cortisol as well. These hormone, and that is a hormone that increases your blood sugar, increases your weight, okay, and decreases your immune function. And so who would want to do that? Well, it turns out that when animals are, I'm going to do air quotes here, prepared for market, okay, depending on how that's done, they are subject to fear, torture, all that sort of stuff. And, this is, I'll admit it, I was not an animal rights vegan at all. I was cardiology vegan. But all of this literature is actually overwhelming now about how the hormones inside the meat of these animals affects human behavier. Now, I'd obviously heard, vegan diet, my road rage went away and that sort of thing, but I didn't pay too much attention to it. Now there's a lot of literature. You saw on my slide, intimate partner violence. That was done at UConn Huskies undergrads. And if you don't eat the meat of slaughtered animals, you don't have intimate partner violence. So bottom line, you were asking a couple things there, is how could it be? It was likely dietary, and as well, excuse me, as the sodium content, but all sodium and hormones. But you also asked, why didn't your doctor say anything about it? And I never get upset when doctors don't follow guidelines unless I wrote them. And our 2017 hypertension guidelines, not just the prevention guidelines from a few years ago, but our ACC/AHA hypertension management guidelines, the number one treatment is actually lifestyle. And we talk about cutting the sodium to less than 1,800 milligrams, having the potassium go up to more than 3,500 milligrams, limiting your alcohol, working on exercise until at least 150 minutes per week, and making sure that you're getting closer to your ideal body weight. If everybody did that, we wouldn't need hypertension guidelines.
Great. Okay, there are several more from Lawrence. He says he's a 71-year-old male. He's been whole food plant-based for almost 8 years. Normal blood lipids and diastolic blood pressure, but his systolic is up around 140. Do you have any suggestions?
So that would actually cross over into patient management, which I'm not allowed to do by our med mal practice. So I can't ask specific stuff, but I can tell you that a lot of times it's difficult for your blood vessels to overcome 63 years of not doing the whole food plant-based. And I can also tell you that the blood pressure would be worse if you weren't doing it now. So but that's a really great, it's a medical management question that if you want to just drop by University of Louisville, I have clinics 3 times a week, and I'm happy to deal with it.
Great. And would you like to talk about the role of triglycerides and how they also go down as a test result when you eat plant-based, oil and sugar-free?
So yes, so a lot of vegan interventions show an increase in triglycerides. It actually happened in the in that intervention, not the one that I did on the south side of Chicago, but the one that was on Netflix. The triglycerides went up a little bit. So what is that about? People eating refined carbs, and that it's, if you look up the history, you probably know it's not just African Americans that have higher than usual ethnic disparities. Appalachian whites are worse than African American, or sorry, about the same as African Americans, and South Asian, Indian, Pakistani, they're actually worse than us. And so, what do they share? A lot of stuff in the diet, and in the South Asians, it's refined grains, particularly the pan and the white flour, white rice, and those are the kinds of things that you absorb them, they turn immediately into sugar, which then turns into fat. And so there is a major correlation between high triglyceride and poor health. But if you try to look at just the triglyceride itself, it looks like it's not doing anything. Well, it actually is. High triglycerides are associated with, for all you people out there who've had your advanced lipid test, a small, dense LDL. Small, dense LDL is much more likely to make plaque than regular LDL, kind of like oxidized LDL. And so triglycerides are very dangerous. Now, obviously, there are some genetic defects where people have, 150 is the upper limit of normal, so-called. I like my patients to be in the double digits because that means they're doing the diet and the exercise well, burning up the fat that's in the bloodstream. But if it's in the thousands, then sometimes it's a genetic abnormality. And if it's in the several hundreds, you can actually get pancreatitis. And that pancreatitis is a very painful condition of your pancreas being inflamed, the nausea, the vomiting, and the severe pain. And it turns out that the outcomes, the mortality rate is way higher if you have pancreatitis from that cause than from any other cause that we have. So triglycerides are something that we should pay attention to because it's basically a referendum of your lifestyle. If you're doing a whole food plant-based diet and exercise program, your triglycerides will be about your shoe size.
Great. We do have a question that hovers a little bit on medical management. It's about B12 levels. I don't know if there's anything you'd like to say about that, but the person was saying, there we go. There's a question.
Yeah, tingling of the feet would be the kind of thing that you'd want to see a neurologist about. And but I'm glad you brought up B12 because I don't talk about it enough. It's one of the things that we really should focus on. And people will argue back and forth about omega-3s on a vegan diet and whether or not you need the ALA and all. People will argue that. No one argues about B12 because B12 deficiency and its anemia and neuropathy and fatigue is just very clear. Everyone should be taking a B12 supplement. I know there are people who don't want to take any supplements. Well, you do have an option. You're not gonna like it. Okay, just remember, and people say, oh, you have to eat meat for B12. No, the B12 doesn't come from the meat. The B12 comes because the animal that got sacrificed or prepared for market actually was eating dirt. Okay, and the soil has the bacteria that make the B12, and therefore you have to either eat dirt, eat an animal, which was a sentient being at some point, or go ahead and take a B12 supplement, which is certainly what I do.
Thank you. Okay, a couple more. If I'm taking a blood pressure medication right now and I begin a whole food plant-based diet, how soon should I see my healthcare specialist?
So remember a little warning from our 2017 hypertension guidelines, home blood pressures. Okay, so when you do this, you should be monitoring your blood pressure, writing them down every day. Some of my patients do it 3 times a day. Maybe that's a little much, but you get the point. Monitor it, and when you start to get to the 110s, you start getting on the phone because you're going to need to withdraw some of the medicine. When you get the 10s, you don't take the pills anymore. That's just something that you would always let your doctor know when you're making changes. So really important not to overtreat. I have had that happen, and when patients adopted the diet and didn't adopt the mantra, which is home blood pressures, write them down and bring them back. And had one patient that I'll never forget, won't say his name, but on the south side of Chicago, who changed his diet radically. It was so wonderful. And his blood pressure was falling. And he got to the point where he was feeling a little dizzy and a little weak. So he didn't call me. He went to his primary care doc. My primary care doctor measured his blood pressure, says 82/50. You better eat meat so you can take your blood pressure pills. That's what he said.
Wow. Wow. Okay, thank you. Couple more. Why don't many cardiologists know this kind of information?
So I've got some good news. It's not published, but you're not going to tell anybody, right? I showed you the Rush Loyola data where very few people were doing a healthy diet and only one was doing the optimum diet. But, I got in front of 5,000 people 9 years ago as the incoming president of the American College of Cardiology. And I tried to make sure there were plant-based options at every meeting and talked about it. And probably the only real thing that was lasting is I started with my presidential executive powers. I actually started a plant-based nutrition group. I'm sorry, it's not the vegan mafia. It is a nutrition work group. It just kind of is very strongly, let's say, plant-based. And these are, 60 people who help write guidelines and help put on programs, and they're moving the needle. And I didn't, it always feels like it's too slow to me because the leading cause of death of cardiologists has always been heart disease in this country, and I want that to change. And so we have a group called CardioServe, that is cardiologists in the American College of Cardiology who agree to answer surveys. And we actually did one about lifestyle. And I just got the results back, haven't written it up yet, but I looked at it, and it turns out that 8% of our cardiologists are plant-based, or at least they claim to be on the survey. Now, I looked at it, 8%, I said, that's terrible. And then it hit me, what am I talking about? That's way more than our general population and way more than our academic physicians that we did a few years ago. It's not victory, but it's progress.
That is great news. Great news. So there's been a lot of new data coming in for women and women's health and cardiac health, especially menopausal and postmenopausal women. Were there any of your guidelines for those groups that changed over the past year?
So what's really happened over the past year isn't so much about postmenopausal. It's really about fetal maternal health, which is a major issue in this country. and it's such a disaster. We're talking about people at a very vulnerable time, and having the system. I showed you that curve where we spend more money than other countries and don't have the best life expectancy. But that doesn't mean our medical system isn't the best in the world. It actually is. And you have a lot of people coming from those highly developed countries. And when they get sick, they want to be treated in the United States. Why? Because we have more capability than everyone else, as long as you have enough money to access it. Now, having said that, our fetal to maternal mortality is very similar to the very low income countries, so-called third world countries. I think of that as a microaggression, so I don't use that term. But the fact of the matter is, we don't have a handle on that, and it's worse for African American women. And it doesn't seem that it's education. You could have a PhD, or you could be Serena Williams, a multimillionaire married to a billionaire, and almost die having a baby. And so we need a lot more work. And so what we're doing in cardiology, because the vast majority of this stuff, these complications, are cardiovascular. We are starting a new subspecialty of cardiology. So I do cardio nutrition and cardio renal and cardio rheumatology, and start a bunch of specialties wherever I was chief of cardiology. But cardio obstetrics is the new thing. And we're hopefully going to get the right thing is guidelines, more literature, more research on how to improve things. I know the best answer is actually a whole food plant-based diet for preeclampsia. And we will see if we can't find keys to unlock this problem. And hopefully that will happen. Now, for the postmenopausal, I just have one recommendation, and that is everybody who is postmenopausal or perimenopausal needs to recognize the effect of phytoestrogens, and making that process a whole lot easier with less hot flashes. And that you get from soy. And everything that you heard about soy, like 5-8 years ago about how bad it was, really wasn't true. And all of the literature bears that out now. That not only does it lower your symptoms during the perimenopausal period, but it actually lowers the risk of estrogen hormone-related cancers, such as breast cancer, that are estrogen positive, ovarian cancer, endometrial cancer. So it doesn't necessarily eliminate them, but they certainly can lower them. And then the other thing for the perimenopausal or postmenopausal group is to just remember this whole idea that men have coronary disease and women don't was never true. And that particularly once a woman is postmenopausal, that drop of protection from the hormones that she's had all these years is going away, and plaque buildup starts to happen very rapidly. And if you're not doing a whole food plant-based diet, exercise program, doing the sleep, measuring your numbers, keeping them all normal. And so I'm hoping that everyone would really recognize that in the postmenopausal state, men and women really are basically the same.
So as we get ready to wrap up, is there anything else you would like our viewers to know before we sign off?
Yes. And that would really be that we all, everyone who's working on this, I'm hoping that you become an advocate, not just for your own health, but for our healthcare system. And I know I've stood in front of a few hundred people and said things like, if you're not paying attention to our toxic level of healthcare expenditures in this country and changing your diet, then you're not a patriot. Well, I'm not saying that. Oops, I just did. But anyway, my point is that we all need to be advocates for a better healthcare system, and that means much more attention to prevention. And so, may that I didn't tweet it out. I was so tempted after the American Heart Association with all those new MOPs that this convention needs more attention to prevention. But, I don't want to insult anyone, but I'm thinking that we really do need to find ways to get the attention of the federal government, Congress, Food and Drug Administration, Health and Human Services, USDA, and get them to pay attention to the medical literature that I've been sharing with you tonight. Why develop all this robust medical literature saying that plant-based nutrition is the best thing for human health and then ignore it? Because of commercial entities who want to influence the process. So we're looking forward very much to what the USDA comes out with, because it's their turn to do the dietary guidelines for America that's done every 5 years. So it will be out in early 2025, but the preliminary report should be out in the next few weeks. And I'm hoping that everyone becomes an advocate. Download it, read it, send back comments, and let's change it. Everything should be whole food, plant-based, and if it's not, we're hurting ourselves.
Thank you so much, Dr. Williams. I love that. Attention to prevention, and we can all do something. Your talk tonight has given me a lot of hope. So if you've joined us this evening, you can find the recording for the whole Know Your Number series and many others by searching Plant Powered Metro YouTube channel. Special thanks again, not only to Dr. Williams, but also to our community partner, Riverdale Senior Services, and everyone joining us from that community, as well as our Jumpstart members. Special thanks to Plant Powered Metro New York team members Leanna Levine Reisner and Jim Spellos for supporting our live stream tonight behind the scenes. And now a special ask. If you learned something new tonight or found value in this discussion, please make a donation to support the Plant Powered Metro New York mission. Every bit helps us meet and reach out to more communities with this life-changing and life-saving nutrition information. In just a moment, you'll see a donate link on your screen. From now through the end of the year, all donations up to $60,000 will be doubled thanks to a generous donor. All you have to do is go to our website or text PPMNY to the number 44321 on your phone. On your phone again, it's text PPMNY to the number 44321. Thank you so much for joining us tonight. Thank you again, Dr. Williams. It was incredible. And thank you so much for being a part of the Plant Powered Metro New York community.